Awkward silence.
All right, I think we're
Hello. We're ready to go.
We're ready to go. All right, hi you guys. Hope that you all are having a fantastic week. Happy Tuesday to you all. We are excited to talk about Vivace today. But first I'm gonna start with some introductions. So I'll go ahead and let Kelly go ahead and introduce herself first.
Yeah. So for those of you who don't know me, I am Kellie Daly. I am the Director of Sales and Service at Rejuv. I've been with Rejuv for just over 9 years, and I started out as an esthetician. So I was working as an esthetician up until a couple years ago, and then have really transitioned into helping manage and coach the clinical team and really help to grow that department and with training and education and things like that. So I love all things educational. So I tend to get a little deep in the science and all of that fun stuff because it's where my passion lies. But I also have been with Rejuv for a long enough time where I kind of know the ins and outs of everything we have. So I feel like I really can answer any questions, whether it be on skincare, the Vivace side of things, which I'm really excited about, or anything, lasers, fillers, anything along those lines. So I'm love to do these Tuesdays talks. It's so fun to interact and engage with people again, even if it is virtually. So thank you for joining, and I hope we can bring some fun and education to the night.
All right, fantastic. Thanks so much, Kelly. And for those of you who don't know, I'm Alyssa. So I started Rejuv a little over 15 years ago. My background is as a licensed esthetician. So I practiced for many years. I think I just celebrated my 20th year as an esthetician. Clearly, I started when I was 10, because that would make me 30 right now. And that feels about right. So I am so excited to talk about what's new, what's hot, what we're up to at Rejuv. This is our second Tuesday talk, and it's just really a way for us to connect with you, to let you know, hey, the Rejuv girls, we're alive. We hope you guys are alive too. We miss you like crazy. So why not use this as an opportunity to connect with you digitally so that you can learn more about your options in rejuvenation, wellness, body sculpting. So every Tuesday we do a different topic. We would love your ideas and suggestions for topics. So feel free to comment in the comments or the chat section if you'd like us to tackle something specific in an upcoming episode. Last week we had a ton of fun really debunking a lot of filler myths. So I think Kelly and I entertained ourselves for the majority of it, but we're okay. I brought my wine again this time. Kelly forgot hers, so clearly I'm going to be more fun than Kelly tonight.
Dang. I'll have to up my game even more.
Challenge. That is a challenge. So tonight we are going to dive into a little guy called Vivace. So Vivace is the newest treatment, I believe, in the clinic, isn't it, Kelly?
Yes,
so
it is.
Go ahead. The last launch. So long story short, with Vivace, I was in Vegas for the American Med Spa Medical Spa Show, and I was not there to purchase anything. I was there as a speaker and as an attendee and just there to have fun. And I had heard of Vivace, and I knew that radio frequency microneedling devices had been around and been on the market for a handful of years. But what I had heard about them is that the treatments were very, very painful, that they were very uncomfortable, and that there was a significant amount of downtime. So I know our market really, really well, and I know what our patients want. And I knew that that wasn't something that our patients want. So I hadn't really looked at it, but I kept hearing in the last year this whole Vivace. And the people that I had talked to had said, "Hey, is there anything like Vivace in your area?" And I was like, "Oh, there really isn't." And they said, "Everything you know about radio frequency microneedling, flip that 180 degrees because the Vivace is absolutely incredible." So what is it essentially? So it is microneedling. So when we say microneedling, whew, I've not even had a full glass of wine yet. I know, microneedling. I want you to think skin pen, right? We do a phenomenal amount of skin pen at Rejuv. I think we're the #1 account actually in the country. So there is a giant jackrabbit running through my backyard right now. Well, that's how he's staring at me. Now you're going to hear my dog. Clearly, I'm not the only one who spotted the jackrabbit. So skin pen is microneedling without any energy. And we do a ton of microneedling, as I was saying. And microneedling is really designed to stimulate a collagen response. And what collagen response does is cause our skin to appear differently than it does before we started the treatment. So by adding that additional collagen into the skin through that wound healing response, we're able to help soften fine lines and wrinkles. We're helped to diminish pore size. It's great for acne scarring. It's great for firmness. So that's microneedling as a whole. What Vivace is, it really takes microneedling and all the things that we love about microneedling, and then it takes everything that we love about radio frequency. And we've worked with radio frequency in the aesthetic arena for at least the last 10 years. Radio frequency has the really unique characteristic of helping to tighten those elastin fibers, as well as helping to increase that collagen production. So we now have in Vivace one device that takes everything we love from microneedling, everything we love from radio frequency, and it marries it together and delivers both treatments simultaneously. The results are absolutely incredible. And I'll let Kellie talk a little bit more about Vivace from the patient experience. So I hope you guys were all able to see Kellie's Vivace diaries. So she recently went through the whole treatment, and of course her skin looks amazing. But Kellie, I'll let you kind of walk through why you chose to have a Vivace, what you experienced during the treatment, and what you experienced post-treatment.
Yeah, so I've done microneedling for a while. I've always loved microneedling, and I could still see myself doing microneedling on its own as like a maintenance in between, but I really wanted to try Vivace because I loved the aspect of that radio frequent energy of really getting that dermal tightening. So there's 2 different layers that we really want to target at the epidermis and the dermis. And with microneedling, we're really just channeling that epidural layer, which is going to give you that more instant, I don't want to say instant because Vivace does it as well, but it's really going to target that top layer of the skin where the radio frequent energy is then going to start to dive deeper into the dermis and really give you that longer lasting skin tightening, which is what I really wanted to start targeting for me in my mid-30s, is to really start to build that collagen, tighten that elastin, and lift and tighten the skin. But I didn't want to have downtime. I really wanted to be able to go back to my normal life right after and not have to worry about having redness or having to cover it or whatever that looks like. So obviously with our new launch, I really was excited to try it. And so I did it actually a week ago, Monday. So it's been 8 days, and I literally can't tell on my skin that I've had a treatment. Outside of that, it looks a lot better. So that's the benefit. But what I loved, so it started out, we did about 20 to 30 minutes of numbing. So pretty common. It's the exact same protocol as what you get with a skin pen or any sort of laser that we do, is we numb the skin just to make it more comfortable. And then it is an all-in-one treatment. So there's not multiple steps to it where you do the microneedling, then the radio frequency. It's conjunctive, combination treatment. So it's a stamping. So it literally just goes into the skin and they do 3 passes and they move to areas. It took about, I think 35 minutes to do my full face, and we include the neck. And it was, you should watch my diary, because I was getting the treatment as I was talking, and it was nothing. Like, I could barely feel it. It was so amazing in the sense of not uncomfortable at all. Like, I'm kind of a wimp. For me, an oxygeneo hurts. I'm weird. But it was really, skin pens can, for me, are a little bit more uncomfortable. I can still feel it. This was absolutely, undeniably really easy. So if you do tend to be a little bit more on that pain scale, it's going to be really comfortable. I also love that right after the treatment, you can see a before and an after. My skin really didn't look any different outside of it had like this tight glow to it after the treatment. So I could really, again, I could have gone to the store if that was a possibility during this time and not have to worry about anything. No one would have known any different. I also love about Vivace is you get a take-home sheet mask to put on. So you can do that within a couple hours of the treatment. It's soothing to the skin, it hydrates it, it really makes the experience even that much better. And then you get a little tiny serum. And that is to boost the treatment, and that's all with the treatment. It comes with it. And so it's, again, just kind of rebuilding that collagen at home. And then you can continue with your normal regimen. I actually continued mine about 3 days after. My skin was completely fine. I didn't have any peeling. I didn't have any irritation. And so I kind of went right back into my regimen within 2-3 days, because my skin was back to what it felt like before that. So from an experience standpoint, highly recommended.
That's probably why they call it the Vivace experience.
Yes.
Because it really is so much more than a treatment.
Oh my gosh, it was amazing. Like, I loved from beginning to end. It was just such a different experience than any other treatment. You know, it didn't feel uncomfortable like a laser does, or sometimes like microneedling can. My skin looked really good right after. I got a mask with it. I got a little serum with it. Like, it was kind of like this all-inclusive treatment that I got to go home with and be able to continue my experience, not only in the clinic, but then afterwards as well.
I think that's what makes it really unique, is not only is it such a better experience, and just really blows my mind in terms of the results that you're able to get with the type of treatment that it is, being that you recover almost instantly, being that it's so comfortable, to really get those spectacular results along with it is what caused me to go ahead and order that thing up without even calling my husband. I was like, I'm getting that thing. We need it at Rejuv. That's a treatment that I would want to have. And your skin looks absolutely amazing.
Yeah, I was very impressed. You know, when you sometimes don't see the aftermath, you know, you're used to like a halo or a skin pen where you're pink afterwards, or you feel like you've got that, especially with halo, you're having 3-4 days of actual like sloughing. You're like, did it do anything? But I can definitely tell a difference in like I said, it's kind of more the tightening. It feels firmer and tighter, and I definitely think the texture has improved, and that's only in a week. We all know that with especially radio frequency and microneedling, we say to give it up to 3 months for full corrective purposes. So I'm excited to see the next, 6 to 8 weeks plus to see how my skin continues to improve. And that was only one treatment. So I'll probably continue the series because it was so easy. I'll do 2 more and finish it off.
And I love that Kelly brought that up, because that is one of the questions that we get a lot. How many should I do, and what is the recommended maintenance with that?
Mm-hmm. Yeah, so, with this one, it's very similar to a lot of our treatments we recommend. It's 3 treatments, 4 weeks apart. You can do it as soon as 3 weeks. So if you have something going on that you want to get it accomplished quicker, we definitely can accommodate that. So 3 to 4 weeks apart, and then that series of 3, and then maintenance is every 3 months or so, kind of incorporating it on a quarterly basis in conjunction with your other treatments that you're doing that are, you know, building and working towards your skin goals. So it really fits in well with all the other treatments we offer, because there is no downtime too. So you don't have to worry about, oh, I have to give it 4 weeks or 6 weeks before I can do a BBL or another treatment. You really can jump right into whatever else you're doing.
And Kelly, I think that one of the questions that I've had, and you brought up Halo, and we have Skin Pen, and we have BBL, and we have Exilus, and we have, I mean, honestly, what don't we have? How do you know if Vivace is right for you, and where would you position it for those patients like myself who does love Halo and BBL?
Mm-hmm. Well, how I would position it is, you know, it really is different. You know, I would love to say it replaces something, but it unfortunately, I don't think does. It really is its own experience. I think it falls right in the middle of doing like Skin Pen and Halo. This is kind of like right in that middle ground. If you're looking for something in between that's going to give you a little bit more correction than, or tightening than maybe Skin Pen, but wanting not so much downtime from Halo. If you're looking for a treatment to do, this could be where it fits. I definitely think that, you know, if you're looking for what your main goals are, if you're looking, you know, really for skin tightening, this is going to be a great option for you to start with. If that's your main concern, number one priority is I want tighter, firmer looking skin, I would go this route and add the PRP. But also you're still going to want to incorporate your Halo in there, because that's going to target, you know, it's a little bit more corrective in the sense of the pigmentation and brightening the skin. It goes a little deeper as well. So you wouldn't want to just throw that out the window if you're already doing that. But if you're looking for something to start, I definitely think it's going to be for those number one priorities of skin tightening, anti-aging. And then if you're looking for something with more correction with no downtime.
I think that's exactly it. And when I thought about my own personal skincare routine and what I like to do, you know, of course, you know, for me, Halo is the holy grail for giving the Halo glow, right? Halo glow, Halo, you guys, light and bright. That is what I want you to think about when you think Halo, and you add BBL into that, and it's just amplified. It's amplified. Browns and reds, BBL is our magic eraser, right? Nothing better for that. And so when you start to bring Vivace into that mix, I think Kelly nailed it. That's where you think about building that underlying structure to the skin. So if Halo and BBL are working on the sheets, if your bed was, or if your skin was a bed, you think Halo BBL working on the sheets, Vivace is working on strengthening that mattress and really giving you that firmness and that structure and that really great texture. So I think that you really have to think of it as a complementary treatment. So for those of you out there who are like, oh man, I just bought Halo, that's amazing. We wouldn't let you get Halo if it wasn't going to benefit you. But that doesn't mean that you're not still a great Vivace candidate. And that really kind of leads us into, you know, what we call combination therapy. And Kelly, do you want to talk a little bit about why actually the hottest new treatment isn't a new treatment at all? It's a paradigm shift in how we treat patients.
Yeah. So obviously, you know, you always wonder like, well, why would I do this treatment over this one? Or why are they bringing on this treatment if you already have something similar? And it really is, you know, we find those things that can complement each other and really work. Melissa touched on it as our bed. We really look at the skin like a bed. You know, we have different layers. If we just target the sheets, your mattress is going to get lumpy and bumpy, and the texture is going to look bad, and you're going to have no support or structure. But if you just focus on the mattress, your sheets are going to be wrinkled and dirty and not look vibrant, which is not what we want either. So we really want to do that combination where we're addressing the whole bed or the whole skin as a whole. And so that's where we really talk about that comprehensive combination therapy, which is combining multiple treatments. Obviously, if you're a new patient to us and you come in and you say, these are my concerns and this is my time frame, we're going to base what we choose for you right away a little differently based on your time frame and what your goals are. If you're a repeat patient, we might just be adding things in your mix that's going to help continue to get you to the goal or create the, like we talked about for filler, Benjamin Button look, where you just keep getting younger looking. So what? We've done that too. So it really just depends on where you're coming in at. And we don't look at a patient as you're a patient. We really look at you for you and where your goals are and time frame. And that's what I was really thinking about for Vivace. I'm like, we have so many people that come in and are like, I have a wedding in 3 months. I want to look awesome. And I'm like, well, yes, you could do halo, but we all know it takes a couple halos to get there. You don't always look great after that. The 4 weeks, you're still kind of transforming. Vivace could easily be that no downtime, amazing results, and your skin's going to look awesome right after. So it's really, again, that fit of where it's going to come into what your goals are in time frame.
And Kelly, you mentioned this, but can you expand on this a little bit more, adding the PRP and what is PRP and why add PRP to it?
Yes. So we, even with Skin Pen, we do this. We have Skin Pen or Skin Pen with PRP, and we also can add it to Halo afterwards as well. You can put PRP right on after the Halo and get quicker healing time, which we've done as well. But Vivace is really known to be with PRP. I did it without, but it was really more for me time frame wise. So in the sense of I needed to be in and out of the clinic really quickly. So, the PRP takes a little bit longer because we have to draw the blood. But what I would say is always add PRP because it's going to enhance your treatment results. So you can stimulate your own collagen about 500 to 1,000 times more with PRP. So think about the results I got with just Vivace, or I'm going to get, now enhance that by even more. And what I love is that even with the PRP, you have the option of then adding injections too. So now we've already got the PRP. Now we can do a little under eye injections to lift and tighten that. We can inject into the nasolabial folds to lift and tighten that more. We can do, a full face injection with PRP and put it on the top right after Vivace. So you're getting this amazing result and almost like a little lifting as well, all in one treatment. And again, with that no downtime, maybe a little bit of tiny minute bruises from the injection sites, but overall nothing. So it's pretty amazing to do the PRP.
Just so flexible, right? There's just so many options. And I think that you really spoke to this, and it's correct for people who are out there and who are listening. It is not your job to try to figure out what combination to do, right? That is why you have us work for you. And that's really what we believe our job is to deliver you spectacular results. So when you come in and you meet with us, we're going to go through and really try to understand what it is that you're trying to achieve. So if you call us and you're like, oh, I think I want a halo, we're not just going to say, great, let me sell you a halo. That's just not how we work. We really are going to say, hold up, let's talk about what you want the outcome or the result to be, because that's the most important thing. So it's not thinking as much about what procedure is right for you. It's really goes back to what do we want to achieve? Because you have to remember, we have a huge toolbox. And even as Kelly was talking, we can do PRP and then we can inject it. We just have this phenomenal toolbox. And you guys, I've been doing this 20 years. We didn't have a toolbox 20 years ago. 20 years ago, we had microdermabrasion with crystal, and then we had Botox. And that was it. So if you came and you said, I need my skin tightened, you're getting microderm. If you said, you can say whatever, and our hands would be like, you getting microderm today. So that's the really amazing thing about the aesthetics industry and being in it today as a practitioner is we just open up this huge toolbox of tricks and we start to have conversations about what do you want your outcome to be? What's the time frame for that outcome? Is it, like Kelly mentioned, do you have a wedding coming up? Do we need to fast forward this? Or do we have more time? What kind of budget are you working with? I think that there is sometimes a misconception that I can't afford it. I can't afford skin rejuvenation. And that's the really amazing thing about being in the aesthetics industry today. Because we have so many tools in our toolbox, we're able to modify to help meet timeframes, to help meet budgets, because it really is not a one size fits all. Kelly's getting crazy over there.
I am. Whoa.
Oh, you know, what I tell people is if you call a clinic and you say, I want Botox, and they sign you up for Botox and they don't ask you any questions and just start injecting Botox about where you want to be and what your outcome is, run, because that's not what it's all about. We question every step of the way. Are we choosing the right treatment for your desired outcome? And maybe Botox was the right treatment, and now it needs to be in addition to something else because your needs are going to change and they're not static. So that's where we take our responsibility for helping build and develop these plans so seriously. And we are specially trained in working through these scenarios and helping to build these custom plans. We call it the Rejuv method. It's really unique to us, and you're not going to find that anywhere else. So it's just one of those things that make us who we are, you know, one of the largest clinics in the nation. And it really is because of our unique and innovative approach to how we combine our treatment. So yes, we're the only clinic that has Vivace, but even more than that, it's how we intermix Vivace with all the other tools that we have that really gives you those wow results. And that's why we exist. That's our mission for you.
Yes.
Ditto?
Yeah.
Ditto.
Ditto.
Okay, do we have any questions?
I feel like it's overwhelming. That's why you come in for a consultation, because we can cover all this specific to you.
Okay, so, I'm going to make up the questions and you answer.
Oh, fun. Yay.
You don't give me a question, people.
I agree for tonight.
Are you ready?
Okay, maybe. Let's see.
Trivia.
All right,
Kellie
ready.
And Melissa style trivia. Kellie, who is not a candidate for Vivace?
Not a candidate. There aren't. This is actually a pretty easy one. So you cannot be pregnant, and you cannot have, because of the radiofrequent energy, we recommend no metal within the area we're treating. So you can have fillings, but if there's any like jaw surgery where you've had any metal, you would not be able to treat in that area. You'd be better a candidate for just regular skin pen with PRP. And then also if you have a defibrillator or a pacemaker, you cannot treat. Those are the only things you cannot do.
That's a pretty cool thing about it. That's why I wanted to ask that question. Pretty much everyone is a candidate. Even inflammatory acne. We can treat inflammatory acne with Vivace.
That is what I love, is that there's not a lot of treatments that you can treat right over the inflamed acne. A lot of them you have to avoid, or you have to wait until the acne is cleared, or this one can actually correct some of that inflamed acne. And when I heard that, I'm like, yes, this is amazing, because we want treatments that we can do those corrective things with, even with having the acne there.
All right, Kellie, you've got one. Kellie, why is PRP so good?
Oh, wow. Well, here's my thing on PRP, because I think that when PRP became really trendy, and it's been studied so much, like the benefits outside of just the aesthetic world, but in medicine in general, the corrective properties it has, because it's your own plasma. So there is literally nothing that can go wrong with this when you're using it. So it is one of the safest things that you can do with the treatment because it's your own body's way of reproducing collagen and really helping heal itself. So it really is an amazing thing to work with. And we're so fortunate to be able to bring it into aesthetic treatments and be able to work with it. So just in itself, PRP is one, it's safe, and it's highly effective and highly studied. So those are my 3 points, but just in the sense of corrective purposes, my personal use and experience with it has been above and beyond. I've used it, under my eyes for injections. I've used it kind of in conjunction with some filler, and I've noticed just an improvement in how my skin overall looks. And again, I just love how it enhances a treatment. I mean, I've done the difference, and with patients, I see this too. When I was more practicing as an esthetician, they would do a skin pen with me, and then they would go do a skin pen with PRP with a nurse, and we do their Vizia, and I'm like, oh my gosh, like your results are tenfold with a PRP. And so it was just really cool to see the enhanced benefit with the PRP over just doing it alone as like a skin pen or something else we were doing. So it's so good because it works and it's safe and effective, and it's just one of those things where you're going to get great results with it. And a Vizia, I see that other question, that is our photo or our baseline. So this is how we take our photos. Are we still only one of the 5% of clinics that has a Vizia machine?
I think we are.
Oh my gosh.
They are not popular. I talk to way more clinics that don't have them than do.
Crazy to me, because this is how we get our baseline photos. So when you come into Rejuv, we're going to take a photo of you, and we're going to be able to be like, all right, here you go. This is where you start. And we take photos after every single treatment that we do. And we're able to be like, okay, this is where you started. This is where you're at. Are we doing our job? And are you following your job at home? So we can have a report card for everyone. It's the best for the patients, I feel like, because a lot of times we can say, oh, look at your skin, it looks amazing, but you see your skin every day. So to you, it might be something subtle, or maybe you don't see it as much, where this way we can really show you the constant improvement that we get every single time. So the Vizia is essentially our before and after tool and photo capturing. And it's included with every consultation.
My favorite part about the Vizia, real skin age.
Yeah.
Who doesn't want, and even if you don't think you do, you want to know how old is your skin. So it takes your chronological age, and then it measures your skin and tells us how old your skin is. So that is pretty crazy to see. And, we see it all. We see people who, we get to see their skin so much younger than their real age. And then we have people come in who are new to this whole world, and their skin has aged well beyond their years. And we get to be the very lucky people who get to correct that. So what a cool job that is.
It's awesome. I love to show people, I'm like, you literally haven't aged in 9 years. It's amazing. Like, I'm a miracle worker, people.
I know it is. It's crazy. I love that piece of the Vizia and being able to just really do that thorough and objective. And that's what I love. It's not subjective. It's an objective analysis and benchmark for your skin's metrics, so that we can make sure, like Kellie said, are we doing our job? Are you compliant with what you're supposed to be doing at home? And that's a huge part of it. So the Vizia is an extremely beneficial tool, I think, for that. So much so that we have two of them.
Yeah.
Exactly. All right. I don't see any more questions popping up here. So just to kind of wrap up, you guys, about the Vivace, and definitely read more about it at realself.com. So anytime that I'm looking at bringing a treatment in, I want to know what patients are saying about it. So realself.com, if you've never spent any time on it, is a ranking site by patients, by you guys, for all the aesthetic treatments out there. And it actually will give that treatment a worth it rating, a thumbs up rating, that patients thought it was worth it. And Vivace is off the chart on realself.com. The worth it rating is absolutely spectacular, like 96%. It was crazy. So those are patients who've had Vivace that go out there and say absolutely incredible results. So that's something that I always do before I bring a new treatment in. It's one thing to read the literature and talk to other practices, but I always want to hear what patients are saying, because ultimately you guys are the judge, right? You guys are the ones who are going to tell me if this treatment is a slam dunk. And Real Self, totally recommend checking that out. The one thing that you're going to find is as you look through Real Self and you type in different treatments that Rejuv offers, you're going to notice a common theme is I don't take anything that doesn't have a really high Real Self rating. Viva has an amazing Real Self rating, as in Skin Pen, Halo, and Vivace tops the chart. It really tops the chart. So definitely check that out.
Yeah.
Special. Oh, go ahead, Cal.
Oh, I was just going to speak to Real Self. Is what I love is that it really does, it gives that point of view from the patient, like real people, not just a provider saying like, it's awesome, because anyone can say their device is great. Like, yeah, it's the best one. But you go there and you're like, oh, why would I choose Vivace over another brand of microneedling radiofrequent? And it's because of that. It's because it gets better results. It's seeing from real patients what their experience has been. And that's how we make a lot of our decisions, or Melissa makes her decisions, is, we want the best results. And that's where we make our decisions from.
Yeah, because ultimately we are in the referral business. So the number one source of new patients for Rejuv is your guys' referrals. So thank you. We take that very seriously. And along with that, we make sure that we only introduce the best treatments, because we know our reputation is riding on that. So you can always feel confident in what you're getting at Rejuv. All right, ladies and gentlemen, special launch for Vivace. And the last time I checked, we have a few of these available. But with any Vivace purchase, we are giving you 30 units of Botox free. Yep, that is a pretty crazy value.
What did you say? 30 units
30,
of Botox?
30 right here. Okay, true or false? Melissa has Botox. I'm scowling. I'm scowling at you right now, Kelly.
You'll never tell.
Huge fan of the talks, people. So 30 units, that is a huge value. I think that gets to be like a $390 value, free with your Vivace treatment. I believe the Vivace is $850, and you get to save your member discount, you guys. So there's a 20% member discount on that as well. So when you start to do the math, essentially you're paying half price or less for the Vivace with this incredible introductory special. So if you guys are interested, we're only doing 30 of those because we have a limited supply of the Botox to give out. So make sure that you either text, call, or email us, 356-SKIN. You can also message us in Facebook Messenger as well, or Instagram if that's easier for you guys. But we want to get that reserved for you. We want you to be one of the first 30 to have the Vivace experience and get some really special pricing on that.
And just so you know too, since we talked about bundling in 3, if you bundle in 3 or more, you save an additional $50 off each treatment. So you actually get $150 off your bundle as well. And that's including your member discount if you're a member.
There you go. Doesn't get much better than that. You might as well just do the whole thing. Whole thing.
Yeah.
All right, you guys, this has been a ton of fun. Thank you for joining us for another Tuesday Talks with Kelly and Melissa.
What do you want to see next time? We'll take requests.
We will, and we will tackle about any subject, even if it isn't Rejuv related.
Yes.
we just like to talk in general.
That's
We
really why we did this is we're very social and we're like, how can we get to talk to other people? Okay, let's do this.
I saw that meme the other day. Introverts, put down your book and check on the extroverts. We are not okay.
Not okay.
And that's so fun. So I'm married to an introvert. And I showed him that meme. And I'm like, this is why I tell you every day, this is so much harder for me than it is for you. I love being around people. I miss my team. I miss our patients so much. But I'm happy that you guys are staying home and staying healthy. But just know that we're here for you during this time also.
Yes. So reach out, let us know. We are here to help in any way we can. And so keep it up. And we'll see you through social media for right now.
All right. Sounds great. Have a great night, everybody.
Bye.